This is the Pulse of St. Louis.
Welcome to the Pulse of St. Louis. I'm Shirley Washington. The Missouri Foundation for Health presented the St. Louis Regional Health Commission with a $1 million grant to use in the second phase of the Prepare STL campaign. That initiative is designed to help stop the spread of the coronavirus in underserved communities. Joining me now, Angela Fleming Brown. She is CEO of the St. Louis Regional Health Commission. Angela, thank you so much for being here.
Thank you so much for having me, Shirley.
Let's start the conversation with a brief background on Prepare STL. How did the campaign come about and what is the purpose?
So the campaign started in response to the crisis of COVID-19 entering the St. Louis region. And it started with our public health departments along with several other community organizations that were passionate and interested in helping to make sure that our under-resourced communities receive the information in order to be prepared to survive this pandemic physically, emotionally, and economically. And so we have been out in the community. We have posters, we have signs, we have community leaders, people who live in the communities that are out making sure that those who are underserved, particularly our African American communities, new American as well as immigrant populations, have the information that is necessary to ensure they are safe during this crisis.
And you mentioned physically, emotionally, and economically. Let's talk about each of those, starting first with physically. How is Prepare STL helping underserved communities physically?
So physically, we are working to make sure that people understand the necessary like hygiene and other precautions that are necessary. So wearing a face mask at all times, anytime you're out, as much as possible physical distance. And so that is what also social distancing, but using physical so people understand that you can still have human interaction, but definitely physically being 6 feet apart from those that you may encounter. And then also ensuring that they're washing their hands with soap and water is definitely the best. But if that is not available, you definitely can use hand sanitizers in order to make sure that you have clean hands and kind of hygiene issues necessary. And then we're also partnering with our community health centers, the local FQHCs in the region, to promote testing availability to community members who do feel they may be at risk or have had an exposure to COVID-19, so they know where to go in order to receive testing as well as treatment.
Are you finding that underserved communities, specifically African American communities, have enough testing resources now?
So now, I know when we first started, there was definitely a gap there, but now we have seen major resources come into our region, thanks to our public health departments, both city and county. Many of our FQHCs that are located in North St. Louis have the appropriate amount of testing. And now testing is available to anyone, regardless of symptoms. So if you want to go out and get tested, you can feel free to drive through at any of those sites that have drive-up as well as walk-up testing sites. And then they do have now, we've had better chances of getting PPE. So we do have that as well for the workers, the frontline staff who are out. So they have the appropriate gloves, face masks, and other things in order to do the testing.
And then where are they getting the PPEs?
City and county health departments have been major partners in ensuring that our community health centers, as well as our community members, have PPE. And so as part of Prepare STL, in addition to distributing communications, we have distributed over 100,000 PPE kits, face masks to community members, so they have the appropriate materials and protections in order to survive, especially for those who may not be able to afford those purchases.
So you talked a little bit about the physical aspect. What about emotionally? Because this is a very stressful time for everyone in the community dealing with this pandemic. So how is Prepare STL helping the St. Louis region in terms of emotionally coping with this pandemic?
Definitely. So when we think about emotion, we understand that there is a lot of grief and loss and social isolation that has resulted as a result of this pandemic. And we have partnered with our partners at St. Louis Mental Health Board, 211, and Behavioral Health Response. There is a number you can call called 211+1, and that connects you definitely directly with mental health professionals who are able to do any type of counseling, crisis management that individuals need during the time, and that is through behavioral health health response. And so if people are not feeling like themselves, just want someone to talk to, please feel free to reach out. 211 plus the number 1 gets you directly to a mental health counselor for those services.
And then, of course, we know a lot of people lost their jobs. A lot of people still don't have jobs, even though a lot of companies have called back workers and their employees. What's being done on the economic front?
So with that, we're also, again, partnering with 211. So if people are having issues with housing, utilities, or other needs, they can call there for resources. In addition to that, Prepare STL has been able to provide direct assistance to our community leaders who reflect many of the communities that we are targeting. So our community leaders come from many of the high-risk zip codes, whether we're targeting African Americans, new immigrants, new Americans. And so many of them that we found, 70% were unemployed as a direct result of COVID-19. And so through this initiative, we're able to fund them. While not a lot, we are able to give them resources as being volunteers for this initiative to provide direct economic relief to many of the individuals in the communities we're targeting.
Are you also providing enough financial resources to help these families stay in their homes? Because as you know, quite a few are facing eviction notices right now.
Definitely. And so we also partner with a regional initiative called the Regional Rapid Response Initiative targeted towards COVID-19 that partners again with 211, and several of our foundations have set up community funds, emergency response funds that we can connect people directly to through 211. So those things are available, and they're also listed on our website. And again, all these resources that I have talked through, whether physical, emotional, or economically, if you reach out to on our website, PrepareSTL.com. There's resources there as well as information to address all 3 of those issues.
And how successful do you think the first phase of Prepare STL has been?
I think it has been very successful, even more successful, I think, that we expected, coming together really on a late night, meeting daily to really put this program together. What has been the heart and the success of this program has really been partnering with community differently and letting those who have that lived experience not only be a part to do our canvassing, but they have actually been the leaders and designers of Prepare STL. And so because they have that pulse of the community, these are their neighbors, their friends, their families, we were able to reach these communities differently by elevating and centering that community voice in this process.
So is it because,
and that has really been the success of our program.
Yeah, so do you think that success is what led to the organization receiving that $1 million grant from the Missouri Foundation for Health?
Definitely. I think that has been one part of really rethinking how we consider community voice, having them be leaders at the table and not just participants, but really directing and guiding this work. And so has definitely increased our impact. And also another kind of piece of what we have cultivated here is the centering of Black women leadership through many of our Black-led organizations, and using those people who have been most directly impacted by a lot of the disparities, help lead and design interventions to really address and help reduce some of the impact that we're seeing.
Of course, the first person to die from COVID-19 in St. Louis County as well as in St. Louis City were African American women. What impact did that have on you and your organization?
Definitely highlighted to us a lot of the disparity that we're seeing, not only with this disease, but in healthcare in general. One of the core tenets of the Regional Health Commission is to focus on reducing those health disparities. And we understand the systemic racism that has been in our region and throughout our system. And so for us, it has definitely elevated and highlighted the need for us to move in a direction to address racial equity, systemic racism, anti-bias behavior that will help, again, begin to address many of these disparities that we're seeing, not only in COVID-19, but also in terms of access to healthcare, again, hypertension, diabetes, substance use, addiction, and other things that are definitely impacting the African American population at disparate rates.
So give us a sense of how the $1 million grant will be used.
So it's in two phases, and the first phase of the grant would definitely be to address kind of the second phase of COVID that we're preparing for, understanding that this is a long haul. Many have estimated a 2-year um, um, kind of exposure and a 2-year focus around this COVID until we get a vaccine up and ready to go. And so we want to make sure that communities continue to understand the impact of COVID and how it needs to still be a focus, and make sure they're carrying their protections at all times. And then starting probably this fall, the second phase of work will be focused on understanding how can we take this model that we prepared in this crisis for COVID and see if it can be worked into other health disparities. And so we're thinking about topics like maybe gun violence, infant mortality, again, substance use that are definitely impacting our African American communities, to see if this model can also help address another issue. And so that is what MFH has invested in. They have, I think, honored the Black leadership, centering of community voice, and really want to see how can we move this model along and translate into other topics.
And then real quickly, Angela, tell me a little bit more about the collaborative effort, because you said this is a group of women, mainly led by Black women. Tell me about that.
Mm-hmm. So we have myself at the Regional Health Commission, and we partner with the St. Louis Integrated Health Network, who is led by Bethany Johnson Javois, who was also the leader of the Ford through Ferguson initiative 6 years ago. Then we have St. Louis Mental Health Board through their partner, Serena Muhammad. And then we have 2 contractors on the initiative that have been very key in making sure that, again, the success of this initiative, with Rebecca Bennett, who is the founder and leader of Emerging Wisdom, and Lorna Godwin, who leads Vector Communications. And so we kind of center the planning and design of this program. And we do this in partnership with our health departments, who have definitely been supporters of letting that community, and as well as the leaders, push this initiative forward.
All right, Angela Fleming Brown, CEO of the St. Louis Regional Health Commission, thank you so much for joining us, and thank you for the work you're doing in the community.
Thank you.
And straight ahead on The Pulse, find out how a local organization is helping to combat child abuse. Stay with us. We are back in a moment. Welcome back to The Pulse of St. Louis. You know, Lutheran Family and Children's Services of Missouri is working to prevent child abuse and neglect throughout the state. Joining us now is Mike Duggar. He is president and CEO of the organization. And Mike, thanks so much for being here.
Hey, I'm glad to be here.
Now, your organization provides a wealth of programs for families and children. Let's begin the conversation focusing on child abuse and neglect. How is your organization working to protect children in Missouri?
Well, one of the things, before we get started, I have to say that this community has been so supportive through the pandemic, the social unrest, and I really want to make sure that I say thank you to MHB, Mental Health Board of St. Louis City, St. Louis County Children's Services Fund, the state of Missouri itself. There are so many people like the United Way that help us take care of children and families in this area. So I need to say thank you before we get started. It's been a very, very difficult time for the children and families that we serve. It's been very difficult to transition over to more of a virtual type of program. But we have 6 core programs that we have at Lutheran Family. We have adoptions, we have parenting, foster care, Hilltop Child and Family Development Center, we have behavioral health and prevention services. And of course, all of those services have some element of prevention when we're working with children and families. So at the basic core of what we do is build relationships with the children and the families that we have, and we take care of them if they can't be taken care of by their parent. We have parenting classes for moms who might be struggling, who might be under a lot of financial stress, who are dealing with a lot of difficulties in their life anyway. And then you have social unrest, you have financial crisis that come up, and they're already just really having a hard time. So we come alongside of them. We try to provide anything that we can do to decrease the stress in their life, and that's across all of our programs.
And so what do you do to help decrease that stress?
Well, I think it depends on the situation. Let me give you a couple examples. So one of the things that we have done recently, and this is allowed us by the other funders that I mentioned beforehand, we had a mom who was in a domestic abuse situation, and we were working with her. We had to get her out of that situation, but she had nowhere to go. So we provided furniture. We got her moved into an apartment. So that is just as a basic, getting them into a safe situation so they can actually take care of their kids. In foster care, we have kids coming to us all the time. And one of the big concerns that we have moving forward is the state, the number of calls to the state hotlines has decreased substantially because the kids are not in school. We're really concerned about what's going to happen when schools reopen. So we're going to see more kids coming into care, but we take those kids in those situations and we provide them with a safe, loving home until they can get back with their families. So those are just a couple of examples.
Okay, so let's break this down in two different categories. In terms of child abuse and neglect, are we seeing that situation escalate amid the pandemic?
Well, it's hard to know because most of the calls are coming from schools. The kids haven't been in school. So you're going to have, and that's what the state director, there's a new state director for Children's Division, that's what his concern is. And if you look at the national research, that's really what the concern is moving forward. Of all these kids have been out of school, they have not seen their teachers, they've not seen their coaches, they've not seen social workers, therapists that they can reach out to, or that the teacher could see that there are bruises on a kid. So they haven't had that interaction. Now they're going to come back, so that's why we're anticipating to see a spike. But I believe the number was a 55% decrease in the number of abuse and neglect cases in the state of Missouri over the last 4 or 5 months.
Okay, so tell me about the protocol, what's going to be in place once school starts, and if you start to identify children who have been abused, what happens then?
Well, what happens is that there is a 800 number that people can call, and we're all mandated reporters. Teachers are mandated reporters, therapists, social workers, anybody that works in a childhood development program, that they make a phone call, and it's a professional referral. Then the Department of Family and Children's Services from the state, they will then open up a case and do an investigation on that. So it's our responsibility, it's everybody's responsibility. If you suspect a child is being abused or neglected, pick up the phone and make the call.
I think you're absolutely right. We all have a responsibility to protect the children. Now, the second issue that I wanted to bring up, because you mentioned it, we were talking about it, is domestic abuse. Are you seeing an increase in domestic violence right now because of COVID-19?
We're not getting a lot of information on that. I mean, sadly, it happens all the time. So, but a spike in that, I'm not getting a lot of data from our therapists, our social workers on that. We are seeing cases, but this is something that we see that's ongoing. Now, I suspect that it's happening, but because of all the issues going on with the social unrest, the pandemic, it's probably not being reported as much. Maybe the moms or the parents, they don't have anywhere to go, especially now since they might have lost their job. So that's something that we don't necessarily have a lot of data on, but I'm anticipating that we're going to see that probably over the next 6 months to a year, continue to see that rise as well.
And speaking of job loss, does your organization provide any type of financial assistance for families that are struggling?
Absolutely. That's one of the things that when we talk about preventing abuse and neglect, a lot of times you're talking about a mom does not have a place to live, or their lights are about to be turned off. And if they don't have a place to live, or if their lights are about to be turned off, somebody can make a call and their child's removed from them, and they're not abusing or neglecting their kids, they just don't have the money. So one of the things that we try to do to decrease their stress is provide some financial assistance. So either pay for their rent for the month until they can get on their feet, pay to get their lights turned back on, give them some money for groceries. I mean, we try to do it at the individual level, the family level, but we can't do it alone.
Oh, absolutely. And it definitely takes a collaborative effort among all of those organizations that you mentioned and the community working together to protect moms and protect children.
Yes.
And then we talk about moms and we talk about children, but we rarely talk about dads. I mean,
Yeah.
dads have responsibilities in their families as well. So,
Yes.
so go ahead. I think I touched on something that you want to talk about. That's fine. Let's go
Well,
for it.
it's something that we constantly want involvement. And once again, we've got 6 different programs, and you can't lump everybody into the same situation. We have dads that are so much a part of their children's lives and love their kids and are actively a part of our parenting program. Then we have some dads that are just not a part of it, and we would love them to get involved, but kids need somebody to be crazy about them. It doesn't matter if it's a mom, a dad, a grandmother, a grandfather, an aunt or uncle. Kids need somebody irrationally, emotionally invested in those kids. So we need more people crazy about kids, regardless if it's the mom or dad, but we definitely need the dads to participate as well.
Well, I'm glad you and your organization are crazy about kids and families, and we thank you so much for what you're doing in the community. Mike Duggar, thanks so much for being here.
Thank you so much.
All right. And when we come back, we're going to tell you about Bruno the bear. His trek from Wisconsin to Missouri, well, it ended here in Missouri. We'll tell you why. Stay with us. We're back in a moment. Oh, you're going to love this story. You know, Bruno the bear, well, he's been making major tracks on social media as he traveled from Wisconsin through Illinois and into Missouri. But Bruno's journey came to an end in the Show Me State. Catherine Hessel explains.
Thousands of people have been cheering on and following along with Bruno the bear. The male black bear started his journey in Wisconsin in early May. He was spotted in Ellsbury, Missouri around July 1st. Bruno then made his way into St. Charles County near the Wentzville area. And that's where Missouri Conservation Department fur bear biologist Laura Conley says that Bruno got himself in a tough situation.
As he moved, he kind of basically got himself stuck in a tight spot. And so really bounded by some major roadways, very populated areas.
Bruno had cornered himself just north of I-70 near I-40.
Staff on the scene basically took a look at the location and how the bear had gotten into that area and kind of made the determination at that point that given the public safety considerations with the proximity to those major highways and the considerations for the bear's safety, that immobilizing him and moving him out of that location was in the best interest.
Missouri Conservation Department experts tranquilized Bruno and moved him to a suitable bear habitat just outside of that urban corridor.
He was transported in one of our bear traps, and so it's a real safe way to be able to move the animal.
Conley says Missouri has a growing bear population.
We estimate between 540 and 840 black bears in the state, and it's growing at about 9% annually. So with that annual growth, we do have those increasing numbers of dispersers that are basically seeking out on their own. And the St. Louis area, there's certainly habitat corridors that can funnel those bears and have those bears kind of facilitate their movement in that direction.
She says everyone in Missouri needs to be bear aware because it's just a matter of time before another Bruno starts his own mating journey.
Regardless of where you live, I think this is a good example that just shows you might have a bear pass through your town, pass through your neighborhood. And so just kind of keeping that in mind, making sure you're not providing easy food sources for bears, especially if you do live in an area, say, south of the Missouri River, where we do get more frequent bear sightings.
Reporting, I'm Catherine Hessel.
And remember, if you spot a bear in Missouri, you can submit the sighting online to the Missouri Department of Conservation. We have a link on our website. Well, that is it for us. Thank you so much for joining us for the Pulse of St. Louis. I will see you next time.